Hello, everyone. Dr. Virginia Ellis over here at Virginia H. Ellis DDS Dental Corp. Today, we're going to be talking about dental veneers. We get people asking about dental veneers, and I will tell you what I have learned in my 23 years of practicing dentistry regarding dental veneers. Let's get started. Dr. Ellis, what are dental veneers? Dental veneers are basically partial crowns that go in your front teeth. And a lot of times they're placed for cosmetic reasons. Or when a tooth breaks and you don't want to do a full crown, reduce a lot of tooth structure, then a veneer is sometimes an option, okay? All right. When would a dentist recommend using veneers? Basically, like I just said, cosmetic cases, when some people come in and say, you know what, I really don't want to do braces, but I like to have a straighter look at my teeth. Or someone comes in and has a, broken tooth and, you have a situation where we can put veneers in there. Sometimes we'll go ahead and do that. It can be a more conservative way of restoring a front tooth as opposed to shaving the whole tooth. You can shave less surface structure off and place a veneer. Okay, what is the difference between dental veneers and crowns? So I just said dental veneer is usually like a front cap, partial cap. And it requires less removal of tooth structure. A crown is usually a full coverage crown. It covers like the whole tooth. You remove a lot more tooth structure, and that's a crown, okay? Veneers tend to involve less tooth structure removal, not always, than crowns. And not every situation, however, is okay to have a veneer, okay? Sometimes a crown is better. It depends on your bites. That's something to consider, okay? That's the biggest factor is what kind of bite do you have? Because if you have the wrong type of bite, no matter how awesome and amazing that veneer is made, if your bite is not healthy, it's not the right type of bite, you will pop it off or break the veneer off, okay? What is the process of placing veneer crowns? Basically, I would say there's a 3-step process, okay? The exploration phase, which I call the consultation. You come in, we look at the shape of your teeth. Planning. It's a planning phase. Take molds of your mouth, mount them up in stone models, study the case, talk to the lab, just basically planning it out. And then you would come in for the second appointment and to prepare the teeth. You shave them, we numb you up. You shave them, we take molds. Sometimes we put temporary veneers in there. We send it to the lab. Then you come back in about 2 weeks. And then we do a veneer bonding process. Basically, we deliver your crowns, we adjust, we bond them, we cement them with bonding material, and then you get to take them home, okay, and enjoy them. Will veneers and bonding cement match my tooth color? Yes, that's the whole goal, right? One of the biggest things about doing veneers is using the right type of cement, using the right type of porcelain, so that when we place them in your mouth, you have a better aesthetic or cosmetic result, okay? That's one of the biggest things, one of the biggest reasons we do that. But it does take a lot of thought prior to coming in and getting this work done, okay? So you have to be patient because what happens sometimes, we get the veneers back and then we're like, yeah, this could be improved or the color's not just the way we need it to be. And then we have to send it back, okay? So the reward is in the patience you have. Most of the time when the veneers come in, cement them, no problem. Sometimes you have to send them back. But everyone does their best to give you the best work possible. So be patient. Just know that when you come in, sometimes you got to send some stuff back and you have to come back to have your veneers bonded, okay? What are the differences between porcelain and composite veneers? Well, basically, porcelain, for the most part, requires more tooth shaving removal, okay? It's made with porcelain, and just depending on the position of your teeth, and this is one of the things we look at when you come in for a consultation, we look to see what teeth are going to need more removal of tooth surface enamel, whether it'll be a lot, what will be involved, or sometimes you could do composite. I've had some cases where people have braces, and they have, open gaps, and they want to have composite, which is white filling material. That can work out as well. Generally speaking, though, I would say nowadays the materials are so good that you can get really good results with composite white filling materials, but the best aesthetic result is the porcelain, okay? One thing you do have to remember, though, people never think about this, is dental work gets replaced, okay? So What you have to think about as we get older, a lot of people say, oh, I like veneers. I really want to have my teeth looking really good. But when you hit 60, 70, 80, I love to do your veneers. But once you just think about the future, okay? Your body changes. At that point, you don't care about having the veneers, okay? You want to be comfortable and healthy. But just know that when we do veneers, sometimes it's a lot of them and it's a lot of work. Think about getting a boob job, okay? When people get boob jobs, those things have to be redone like about once every 10 years, okay? Do you really want to be going through that every so often? It does happen, so do keep that in mind. That's part of the expectations you have to realize, okay? Dental work does not last forever. It can last a very good long time. What should I do to care for my dental veneers? That's really important. So basically, brush and floss. You should definitely, if you get a dental veneer, wear a night guard. Wear a night guard, and this you cannot put over your teeth. I actually wear one, and you just kind of go like this, put it on. Very easy. It stays on. It's super hard. I recommend the full hard night guards. There's all kinds of night guards out there. Do not go into a drugstore and get a night guard. That is not going to be the same thing as something that takes 2-3 weeks to make. There's no way that they compares, especially when you're already investing all that work on your teeth, okay? So basically, come for your dental checkups. Have us regularly check your teeth. Come for your cleaning appointments, brush, floss. Once you have veneers, you have to remember that you can never really bite on toasted bread. Do not bite on steak with bone ribs. You just can't do that. Don't bite on corn on the cob. Don't bite on apples. You can't do that anymore. Even when you have full crowns, you can't bite your nails because you'll break the veneers. Even with a full porcelain crown, you will chip them, okay? So you just have to know that the way you're going to eat your food is going to be different. You can't bite on things with your front teeth, can't bite your nails. Take care of your dental appointments. Make sure that you come in and brush and floss and wear a night guard. How much do veneers cost? Well, veneers are not cheap, okay? They cost almost the same as a crown. I would say an average, depending on where you live, I would say budget about $2,000, okay? Obviously, if you live in a cheaper state, it's going to cost less. But if you live in like California or New York, it's going to cost you more, right? So, and don't go for the cheapest. Do not make that mistake, okay? Go for the person that is going to give you good work and good value for your money. You're already shaving your front teeth. You don't want to have a nightmare, okay? I had some patients, one of my patients' wife go to, Costa Rica. Got veneers. Surely enough, on the flight back home, I kid you not, her first veneer falls off on the plane back from the dental office, okay, after they're leaving. 2 weeks later, another one comes off. So do not go to other parts of the world just because you think it's cheap, because then when you have problems, they're too far away to take care of it, okay? And we don't even know what materials they use. So just because you're trying to save money, this is not the kind of thing you save money on, okay? You just go pay the money. I would just say $2,000 a tooth, sometimes $2,500 a tooth, $2,500. Yes, June 2024, I would say about $2,000 on average, okay? I would say between $2,000 and $2,500 a tooth, okay? Does insurance cover the cost of veneers? Usually not. Sometimes it can. It just depends. Obviously, if it's for cosmetic reasons, for visual reasons, aesthetic reasons, they usually won't. It'll usually be a necessary thing, but you could just check with our office and we can do the research for you, or you just call your insurance carrier and have them, research it for you. And that's one way you can figure it out. But most of the time, they are not covered unless there's like a crack to the real reason to do it. And even then, you'd have to like pre-estimate it and get it pre-approved. But I wouldn't rely on insurance companies to pay for your veneers, because usually they'll pay like $1,300, at most $2,000. $22 is about as high as they go. And unless you're doing one, that might cover. But most people, when they do veneers, they do multiple teeth. They don't just do one. So the amount that dental insurance covers is a pittance, okay, compared to what you need. Don't rely on the dental insurance, okay? What are the financing options for getting veneers? So basically, since most insurances don't cover you are going to pay out of pocket, basically. But they do have some third-party credit companies that you can apply to. I know Care Credit's one of them, where you can apply to have them finance it for you. You pay monthly. And I believe, I could be incorrect, but usually they will not charge you interest if you pay on time. If you do not pay on time, watch out, because it's like a credit card. They will charge a huge interest rate, okay? You just, buyer beware. You should be informed. It is possible for you to make the monthly payments with very little to no interest. Unless you're late, then you're going to get yourself into trouble, okay? How can I schedule a dental veneer appointment? Oh, it's very easy. You could just call me to 925-254-4043. If you happen to live too far away from my office and you're in another state, just call the dental office and find out, okay? And then go for a consultation and go where you're comfortable. Definitely study this. Don't rush into it, because it's an aggressive procedure in most cases, unless it's like a composite filling material. You're shaving teeth, okay? You are doing irreversible changes to your teeth. That's one thing you have to consider. So, that's it. I will go ahead and see you at the next visit. If you like this video, remember to give it a like. Share it with another person you're thinking of helping with their veneers, and subscribe to the channel. We will see you at the next video. Bye!